As Picard just introduced us, welcome Dr. Dawn Martin. She is internal medicine specialist. I have worked with her we almost made it 10 years before I left. Amber made it a couple of years, and I figured this was a good opportunity to bring to everybody all about internal medicine, what that includes, how she got there herself, and then we go from there. And how she would scare certain people.
I feel attacked. I do. I feel attacked.
Looking anywhere at you.
No. But like as previous conversations that we had when we talked about how we got into certain aspects of veterinary medicine, and I went into internal med, and the doctor that was so intelligent, so the way she carried herself scared the absolute hell out of me, excuse my language, would be Dr. Martin, who I have the utmost respect and love for, and I miss her every day. I learned so much from you.
Well, that's so nice of you to say. Well, I miss my previous team, as you know, and thank you for inviting me. It's nice to see you guys again. Picard has joined us. Picard is the orange captain of my team, and she is always around to scream at us, so I apologize. So I will say, first of all, that I was lucky enough to work with you guys, and I miss that. I am an internal medicine specialist. I developed that skill, I guess, by accident, in that when I went to vet school, I very much enjoyed the puzzle of internal medicine. So I was in vet school and I did my internship, and I said, I don't know what I want to do. And then every time I had a case that was an internal medicine case where you have to put all these little pieces together, that was what captured my interest and excitement, I guess. And so that's how I ended up shunting myself or being lucky enough to have the career that I'm in internal medicine. My veterinary school and my specialty were all in Canada. And then I spent several years in the U.S., as you guys both know.
Yep.
And that's it.
So how many years of college did you end up doing?
Oh gosh, so that's a lot. So before I went to vet school, I did a biochemistry degree with a chemistry minor. So that took me 5 years because it was an honors degree. And then I went to vet school after that. So vet school was 4 years, and then my specialty was 4 years. So it's a long road to be a specialist, but it is, I think, well worth it. I always say I work hard, I work long hours, and I am so lucky to do what I do.
And you're very good at it.
She is very good at it. I said no to working internal medicine for a year because I saw how many hours they worked.
That is true.
I said no.
Joyce?
I said no.
Joyce, when are you coming to the dark side? Joyce, when are you coming to the dark side?
To say Joyce, I would get random text messages sometimes in the middle of the night. It would just be like, come to the dark side. And then things happened with her text, and like someone needed to fill in, and I tried to push for other people over me, and then finally it was my turn, and she never let go. The claws were in.
Yeah.
Not untrue. I was like, okay, I've been working on this for a while, now that you accidentally became a member of the team. But then you didn't want to leave, so there you go.
Didn't leave.
You liked it.
Didn't leave for a long time.
Mm-hmm.
I did teach you what a blueprint was, though.
Yes. It's a piece of paper on which we put the layout of a particular space. Oh, yeah, that was... What is a blueprint? Well, Martin, that's a piece of paper. No. The blueprint for this.
And she would literally, like, I told her exactly what a blueprint was, thinking she was serious. And then she was ultrasounding, and she just looks at me, she went, thanks, Tips. I meant for the room. I cackled for like 5 minutes, and I'm like, I don't know what the blueprint is for this room. Come on.
Sometimes I have a lot of open windows in my head. All of us know this.
A lot of lane changes.
I'm not always linearly doing something. I'm doing 3 or 4 things concurrently. So sometimes it's not exactly the logical thing to ask a question that I'm doing in my brain. I get that.
I miss those days. We'd be sitting there having a conversation, right? Then the conversation would stop, and then it would like roll over minutes later after silence to a conversation we were having at 8:30 in the morning.
And she's like, "Oh, so but Joyce, what did you mean by like this owner called? And I was like, Martin, that was at 7:30 this morning. It's 11 o'clock. And she went, yeah, but what do you mean? I was like, they're coming in an hour. And she went, okay, good.
Yeah, that tab was buffering, and it finally populated. I love it.
Listen, that window needed to close before it needed to come full circle. We need to know what that is resolved.
Yes, and you were able to close it.
Yep.
Gone. I get it.
Yes. So it's perfect.
And
It's a veterinary medicine internist skill, I think, that you have to do multiple windows at once.
But what
so
about
that you can?
But what about the sticky notes?
Oh, sticky notes are the best. Yes. Joyce, dear Martin, today is Thursday. It is Thursday. Still Thursday. How many times? What day is it? What day is it?
Point at
Still
the
Thursday?
and at the sticky note that is currently sitting on her ultrasound machine with the date changed out every
Today
day.
is Thursday.
And we would just go boop boop boop.
Thursday. Listen. Sometimes you just have to do the basic things get lost in the shuffle. Just get in there, get to hang out with your team.
Oh my
get
God.
to see a bunch of animals.
One
get
of
to
the
hang out with a bunch of
Very,
humans.
like, we'll get back onto the whole internal medicine thing, but like the very first full interaction of her working in the clinic that I was at, and this dog wasn't eating, and she was like, you know what this dog would like? Peas, Joyce. And I looked at her and I was like, this dog's not going to eat peas, Martin. And she was like, just wait. So she goes and she gets her little peas and she puts soy sauce in it. And I looked at the dog, dead face, and I said, I swear to God, dog, if you eat this, we will not be friends. The dog didn't eat the peas. Did not.
No.
That was
Spoiler alert.
was one of my first
But
interactions.
sometimes when you've tried protein and you've tried sweet and you've tried savory, something completely novel that they've never seen before might be the answer. So I was pretty confident the dog had never eaten a bowl of peas.
And you were also confident that he would like it.
Listen, my cats love peas. So
Cats aren't normal.
my cats do love peas. And my dog loves peas. So
Also not.
but when you eat peas 3 times a week, I guess that's what happens. And they're good for you. There's nothing toxic in peas. It's very healthy for the animals.
Uh-huh.
And especially as a breakfast choice, Dr. Martin.
It is a good
What are you
breakfast.
eating? 30.
Peas!
My lunch.
And it's always the same thing. Peas, they're so good.
So good. Listen, I still get mocked in rounds if I bring peas for breakfast.
As you should.
Nothing ever changes.
I love it.
Listen, sometimes I bring yogurt and fruit.
Huh? That's, yeah, Picard agrees.
That you probably eat at
No,
like
that's Riker.
4:30 in the afternoon when you decide that it's time to finally take a pee break after all the water that you've drank and all the patients that you've seen. Yeah,
Well, first, and then you get to have Twix o'clock.
Twix o'clock.
We did have
Yeah.
a drawer full of goodies, and we made sure it was stocked at
Yeah.
all times.
Mm-hmm.
I do remember that.
Yes.
Yep.
To get a lot of work done before you could have something from the drawer. Or I.
That was her rule, not mine.
Yeah. For me. Oh, that's only for me. Everybody else can take whatever they want. All I do is just throw stuff in there. Listen, you have to have fun at work and you have to take care of your team because without a good team, you're nothing.
Correct.
Like-
Agreed.
No veterinarian is an island. No veterinarian can do this without however many people will stand behind me.
Yeah,
And that's the bottom line.
you being the caliber of doctor that you are and having such respect and admiration and advocacy for your team, you don't see that. You don't, because I remember how hard you advocated for us. And even when I stepped out of my position, I don't say necessarily like I didn't step out of your team, like I still felt like I was a part of the team because I spent most of my days still over in internal medicine. But just because that was my comfort zone, that was when I'm having a bad day, I need to be with Dr. Martin and Joyce. Like that's what made me be able to get through the day. Just 5 minutes over there and I can go back and I can get my job done. But like, that is just how you are. I can't tell you how much respect that I have for you. Like, even, like I said, when I stepped out of that position, I was the practice manager. You would come to me with things that needed to be changed and fixed for your team. As you're a team or individuals on that team, like you were very passionate in your advocacy for that. And I will respect you for the rest of my life for that. Always.
Well, thank you.
That's what.
Well, I respect my team that takes care of me.
Yeah, and that's what drove. I can't speak for Joyce, but like that's what drove me to work so hard for you and to be okay with working the long hours and taking on the extra cases, because when we were getting results, we were, you were finding the things that nobody else could find, but at the same time, like we had that bond that we had each other's backs. Like, we're going to get through this day. We're going to take care of these patients. We're going to work with our caseload no matter how heavy it is, just because of how we all were to each other, and especially how you led the team.
Thank you. Well, I think that is the most important thing that anybody could say to me, is that I can help animals because I have this ability to pull in the people, because I can only do this much of it. You're right, we were able to help a lot of animals and a lot of owners because we could really support each other.
Yeah.
You could say, this person needs to talk about the 7:30 in the morning call. You tell me at 7:30 in the morning that there's a call that's urgent. If you tell me about it, I know it's handled.
Mm-hmm.
Because if you tell me, if you have a team approach, then the owner gets to tell you, who then gets to organize it and then tell me when I need to get involved. But the best way that it happens is if the team, who knows the capabilities of the day more than I do sometimes, right? I'll just keep going until I fall over or sleep for a little naplet. A snack nap, as I call it.
No, it's the 5-minute nap, and it's a real thing with her. She just needs 5 minutes.
The best. 3 to 7, gone. And then I'm back. Listen,
Celsius and a bowl of peas, and we're good to go.
Piece of chocolate, a 3-minute nap, and a bowl of peas, and we're good for
Good to
12
go.
more hours, baby.
Yep.
No. I am not. I would not want you to think, anybody to think that they would have to work like that. But I do think that our field really does pull those people who really want to help. It's a compassionate career, right?
Mm-hmm.
It is. It's a career of passion and compassion, and you have to like it, or you won't. You won't do it forever, or you'll burn out. And even people who are not too compassionate, but people who are compassionate but don't have boundaries around their compassion, will burn out. And I think that we saw a lot of that sort of over the last few years, right? That there was, because when I ask my team to do all the things that I ask them to do, but then the clients don't see that because they're doing it too well. Like, really, our clients sometimes don't see the work because it's done so efficiently, right, by you guys. And then that's why people get irritated. Like, can you do more? Can you do more? We can do more, but we need to have an ability to say, okay, we today cannot do more. Right?
We have to recognize our capacity for care.
Right. And that's where somebody needs to put the brakes on me, which we know.
So the way I tell people on what is internal medicine, I work in layman's terms.
Mm-hmm.
Martin does not. She uses all the fancy words because she spent 13 years. I counted on all my fingers on how many years she just said she did. 13 years. So she has paid for those words. I didn't. Mm-hmm. I just say that people bring their pets that are very sick, that they don't have an answer to, that their vet can't find out. So they refer them to you, as in internal medicine. And then you're going to go in more in depth of what all the fancy words that means.
That's it in a nutshell, right? If you go to a general vet and they have 4 solid years of education and they still can't figure it out, then they need some help. And so then they need to go somewhere that has more advanced diagnostic tests, like all the big words. So ultrasound, we can do imaging, we can do special blood testing, and all of those things can help us come up with an answer. And then also scoping, like endoscopy, which is like a colonoscopy for people, but we do upper and lower. In veterinary medicine, we can look inside noses, we can look in bladders. So we have a lot of capabilities, and I can do all those things that a generalist can't do. And I, again, have all the respect for the general vets who do all the things that I can't do. So by the time it comes to me, I will often be able to say, I don't know about that, because your vet is well up to date with all of those things, and I am not. But I can tell you about these weird things that you might have. I get to see things that are difficult to figure out. So My friend who's an ER vet says it's like a Kinder Surprise. Like from the outside, it looks like one thing, but then if you twist it open, there's a whole bunch of other stuff and you have to put it all together. So I like that analogy. And she said that that's my specialty is Kinder Surprises. Trying to figure out how to put the pieces together on the inside.
Yeah.
I thought that was so cute.
It is, and she hit the nail on the head when she said that, because like literally watching you put together these complex cases in terms of diagnostic blood work and imaging, and like watching you study these files so hard to put this stuff together, it is literally like a Kinder Surprise. You get this patient and you crack it open and there's like 900 million things and 900 million tabs you have open at the same time trying to make sense of one thing.
Mm-hmm.
And it's yeah, and there's definitely a place for it. Like general practitioners, there's only so much. I hate to say use the word limits, but and literally they'll tell you like you need to go see an adult. Like, here's
phone
what we
a friend.
did. I'm concerned.
You need to phone a friend.
Go see an adult. You know what I mean? Go see the internist. It's you guys you think differently. You know what I mean? Not to say that general practitioners don't, because I've seen some amazing diagnosticians in general practice. But you are programmed to think differently. Not only do you look for the zebras, but you look for the 6-legged zebras while you're going through it. You know what I mean?
Well, and that's just training.
Yeah.
It's for 4 more years, right? Of just reading.
Yeah.
So learning cases, and it's such a joy to try and figure it out. I mean, sometimes
A joy. Spoken like an
sometimes
internist that say it was a joy to figure out.
It often is, but sometimes it really is like I'm going to need to phone a friend. I don't know. And that's the best thing about being an internist in a place where you have a lot of people who are super smart, right? Like you have your ER vets so I work with ER and specialty. I don't have any generalists in my hospital currently just because of the way of veterinary medicine. And I will text my generalists and I'll say, I don't know what this is. Can you tell me? I'm not beyond that. But it's really nice to be able to walk down the hall and say, hey, to a radiologist, and then to the surgeon and the neurologist, and everybody's in the same building.
Yeah.
So you can phone a friend so easily and then you get to be like, listen, you've had all of these great minds come together, right? Like I'm just one person, and I'm also lucky to work in a place where we actually have hospital-wide rounds. So I can if I have a case that's truly stumping me, I'll take it to rounds. I'll say, listen, I know this is not in the hospital, but can I talk about this case? Give me 2 minutes. People can you just help me figure out where to go? These are my thoughts. But it's oftentimes like the things that are surgical and medical together, right? So it really is a nice thing to be able to do. And I think that all that behind the scenes stuff is where sort of people get a lot more even than they expect when they come to just see one person.
Yeah.
Because I am not too proud to ask for help. There's no doubt about that.
And that right there speaks volumes, because there are some they're too proud to ask for help and don't know when it's time to phone a friend. You know what I mean?
And that comes with confidence too, right?
And it's not like a malicious kind of a thing, but it's like hey, listen, it's kind of time to maybe escalate this to internal med or to surgery or to neurology or something like that. Like,
yes,
it's time. The patient's out of time, the owner's out of money. This is our next.
Yes.
Yeah, I do.
And that is it's hard, right? Because you're trying. None of us are trying to do anything but do the best for the patient.
Yeah.
But you also have, like you said, to recognize that sometimes you can do more by getting that patient to a different person, and sometimes people don't click, right? Like sometimes for whatever reason, that was a general statement. That's like waxing poetic statement. Sometimes people don't click. As I like to say, not all relationships work. Sometimes, texts don't work with certain doctors because you don't have the same sort of communication style. So you try and work around it and see if we can negotiate it. And some of my favorite texts to work with have been texts that at first we didn't speak the same language. And so we sat down and said, how do we speak the same language? I think we're trying to do the same thing. Are we going to the same space? And then became great parts of the team. But then sometimes clients don't also work together, right? Like you might not work with a client the best. So you say, do you feel like you're being seen? Do you feel like you're being heard? Or do you feel like you wanted another specialist? And there's no harm in that either, because you have to have a lot of trust.
Yeah.
When you have a little four-legged creature that can't advocate for themselves, or three-legged in my cat Riker, if you have a creature that can't advocate for themselves, then you have to advocate as a client and also as a veterinarian. So everybody has to be working for the same goal, which everybody is. Nobody is not trying. By the time they come to me, the people I see only have their pet's best interest in mind, right?
Absolutely.
Yeah.
Yeah, and the other veterinarians have, but there's no harm in it not working out with a particular person.
So what are some of the disease processes that you see? Like, what's the bread and butter of internal medicine specialists?
Well, the bread and butter of internal medicine is, I would say, a lot of internal medicine is like gerontology in people, like aging pets, trying to figure out what is happening, why they're losing weight, why somebody's not eating, why somebody's vomiting. So a lot of gastrointestinal stuff, so vomiting and diarrhea, I see tons of that. And those guys are good because oftentimes those diseases, weight loss, there's a lot of diseases that can cause weight loss, vomiting, diarrhea that are really good diseases if you can figure them out and get them on a plan, right? So my favorite is to find a disease like inflammatory bowel disease, which is like a first cousin of Crohn's or colitis in people, that has a little bit, like the immune component of it is very much like human medicine, but the disease process itself is a little bit different, but ultimately it's very similar. And then to be able to say, I'm going to give you a treatment plan, and I have really high confidence that you're going to get better. Like that's my favorite day, is if I could tell everybody that their pets are going to get better, obviously. Like cats that have excessive thyroid hormone that lose weight. That's a great disease. You just give them medication, or you treat them with some iodine therapy, radioactive iodine, a special form of therapy. They can be fixed, managed, or cured depending on the way that you go about it. So, and then there are days where I see a lot of bad news cases, right? I find things that are not going to be fixable, but at least we figured out what's happening. And there's almost never that I don't have some sort of option to offer that's going to help extend quality.
Mm-hmm.
So even if we can't give a lot of time, then we can often give some quality back. Obviously we would think about cancer being the worst thing in many cases, because it's not going to be curable, but it's going to be manageable. A lot of cancers are manageable. Then in my practice, I'm lucky to have an oncologist, two oncologists actually. So once they get their diagnosis, then they get to go and chat with a cancer specialist, and so they go to a different department, and then they have the best quality care with two people who are up to date on all the literature and all the things that are first best practices. So yeah, I am very grateful that I do what I do, and I do it where I do it, and I do it with the people I do it with. But I'm just lucky that I like my career, right? It's hard. It's a hard career, but it is such a good career. And sometimes I get to snuggle cute things.
Exactly.
Sometimes.
I mean, I do have a propensity to wander by and just wave at cats. The ER vets are, you don't know that cat. I don't care. It's cute. Can I wave?
Yeah. Hi. Come
It doesn't have. That's not coming to medicine. It doesn't have to.
Nope.
I just need to say, you're so cute. I can't even take it.
Yeah. Yeah.
Or the angry cat whisperer.
Yeah. Like, hi, kitty. Come on. Stop being mean with me.
Right. This one's being feisty. Is it? Swing around on her little stool from the ultrasound machine. So, okay.
Let's bring it. I know. Because cats who are feisty are just really stressed.
Yeah.
They also want the streets. They also want with your blood.
Okay, sometimes yes, but it really comes from a place of anxiety. So
Same.
I really do.
Same.
I would love to say that.
Just
about
same.
my cat, but I think Dr. Lintovich would beg to differ on that when it came to mine. She's I don't think it was anxiety and stress. I think
Your
she
own
was
cat?
born as a seed of the devil.
Yes, her cat is
She
not.
was just
Not great at the vet? That's
Dr.
too bad.
Lintovich has experienced that on 2 separate occasions with
Oh, I did. Yeah.
Anyway, she got kicked off the donor list. But yeah, I do agree about the fear and the anxiety, but she is born of lava and piss and vinegar.
Well, some cats just are not going to be happy in a vet hospital, and some cats are. I mean, let's say there are some cats that are not even happy at home. So really, what are you going to do?
She attacks everybody. Anywho, I digress.
At least
But she is.
I
She's not
literally
prejudiced.
just say to people, does she hate everybody because she's hurt my feelings? And she's like, oh, she hates every vet. I'm like, oh, phew. God, I feel so
That's
much
awesome.
better. It doesn't.
So what
Yeah.
if you could think about it? What has been one of the most challenging cases that you've encountered, like a disease process that I'm not gonna say nobody else would think of, but something that you found that was a challenge to get to, and when you actually were able to diagnose that pet, like it was like, who'd have thunk that this was even a possibility? Like if I'm saying that correctly, like something that just kind of like stumped you, but you were able to get to the bottom of it and get that pet on a good path.
Well, I think that the ones that you get stumped by and put on, but then you find it and put it on a good path are actually not the ones that stick with you as much as the ones that you cannot figure out, and then it ends up to be for something sad or like I had a dog in my residency that had a deep-seated fungal infection, and I really thought that's what it was, but we could not find it. You know, we did biopsies and we did this and that, and we found it finally. It passed just a tiny bit of the fungus in a urine sample. And I just kept looking at the urine over and over and over and finally found it. But that dog, by the time it did that, was just so sick that she never really had a good recovery. She had some time, but she didn't have a really great recovery. So that's one of the ones, and that's a disease called aspergillosis, and it's just frustrating, right? And then actually, a little feel-good story for veterinary medicine is a disease called FIP, which is feline infectious peritonitis, which is a coronavirus, right? But it is a weird mutation, see? Basic, weird mutation of a virus that basically takes over a bunch of organs. So it causes granulomatous disease in cats, and it used to be a death sentence for cats. And there's now a commercially available drug that you can treat and get very easily, quite easily. It used to be for years and years, people used to have to source that drug on their own and without any sort of regulations around it. And it was kind of a known entity that you could get this drug to treat FIP. But, you know, as veterinarians, we had no rules or regulations around it. We weren't allowed to dispense it. We weren't allowed to have it. Now it's commercially available. And literally, now I see these cats who come in so sick, and within 48 hours of starting the oral therapy, they're literally improving. 48 hours, like 2 days. Wow. So that is probably one of the diseases that I've seen the most lately that I've been, because it's only just been for us, months that we've had that orally available and commercially available for us as a compounded. And so I've seen a bunch of those cats lately and just been absolutely, I mean, I hate to go back to the joys, but I have had a lot of joy of seeing those cats go from decrepit, sickly, young cats that can barely eat, and then 2 weeks later on their first recheck, they look like normal cats. It's insane and so wonderful to see. And that's just research, right? That's just people found it, did it. Yeah. Smarter people than I, as I like to say a lot. Or combine smarter people. That's the other thing is that I like to say to people, well, smarter people than me have figured that out. Well, I mean, a bunch of smarter people than me put it together and said, this is what we should do. I just like to try to keep up with things like that, if that makes sense.
Makes perfect sense. It does. Because
so that's fun.
And where I'm at now, we do quite a bit of FIP cases, especially with rescues and things like that, and I'm ordering that drug all the time.
It's
Although,
insane.
yeah, I'm order and
Yep.
I remember, back in the day in younger years, the words
Mhm.
FIP, you knew that kitten or that cat, it was
Yep.
not a good situation, a
No,
horrible
it was
diagnosis.
truly terminal.
And now it's like, okay, we got you covered.
Mhm.
You know what I mean? So,
How long does that drug like lengthen their lifespan?
So 80%, 85% of cats will go into a remission, and that remission can be forever. Like some of them have what we think, or what we think is cure. Don't know. There's always potential for remission, or relapse, but there's animals that in the timeline that they've been studying it have never had a relapse.
Do they?
Then there are a few. Yep. Go ahead.
I was gonna say, I was like, do they pass it on still if they're in remission?
Well, they've already the diarrhea associated, or the coronavirus associated diarrhea was long gone when they're
Okay.
kittens, right? So the answer is not to my knowledge. I might have to read that literature again, but I don't think so. Once they're in remission.
so I have a question, right? So we know in our field as technicians, most
Mm-hmm.
technicians, right? We know the acronym FIP, right?
Yes.
Feline infectious peritonitis.
Yes.
And you say that, when the diarrhea resolves with the coronavirus and things like that, still being able to spread that virus. So when the cat
Mhm.
gets FIP, is it basically like a tidal wave that comes in and does damage and you have to manage it afterwards? Or like how does that disease process work? What does it affect? Like what does it do to the patient?
Why does it do that? So it causes these inflammatory plaques that's the infectious peritonitis part of it, right? So the inflammation itself will go into the lymph nodes and into the organs. It can even go into the lungs, and it's a weird place for it to go. And then it is just inflammatory tissue, but it's such a large amount of inflammatory tissue that it actually impacts the functionality. It can go in kidneys, liver. The one we see so much is lymph nodes. It can be in fluid it can cause fluid, right? That's a big one that we see, this wet form.
Yeah.
So it causes this massive inflammatory disease.
Okay.
Inflammatory, specifically causing these granulomas where there's a bunch of different cells if you biopsied it, it's just like white cells and macrophages and all of these things. You don't see, unless you do special staining, you don't see the virus. You just see this inflammation taking over.
Because I know, like I said, you know the acronym FIP and you associate it with, oh my God, that's not good, and now we can do something for it. But what is it? What does it do to the body?
Mm-hmm.
What a process does it affect? So thank you so much for clearing that up.
In the spinal canal, in the spinal cord. Yeah. Indeed. So that's a good one. That's one that's changed or sort of changed over time. But and you're right. Like general vets are doing a lot of it now too, which is great, right? Because you might need me to diagnose it, to ultrasound, to do biopsies. With the advent of maybe it being detectable in urine, it might be a little bit less important. But sometimes you do need to send for diagnosis, but then to go back for 42 to 84 days of therapy, sometimes that can be at your vet if we don't need to do special rechecks. Indeed. So, what did you miss about Joyce being in veterinary technical world? What's your favorite case?
Gosh, it's not so much case, it was the patients that had the disease process that we worked with. Like Magic. Amber,
Yeah.
you didn't meet him. He was a cat with lymphoma. His name was Magic, but I called him Magique. Majik. I'm not a big cat person, but I loved that cat. And he had the best owner in the world. He was very no nonsense. Yep, this is my cat. Here we go. And like that cat would always headbutt me. And like this is going to start off really bad, but it ends pretty good. He had a reaction to vincristine when we were doing the CHOP protocol on him. And he had vincristine like 4 to 7 times. I know that's a big range, but I feel like he had it at least 5 times to give a generalized, like in his regime. And he went to anaphylactic shock. Like, I gave the vincristine, flushed him, and I was explaining to another technician, like, yep, this is how we do this, this, and this. And she's like, is this how he's supposed to be? Because she was just cradling his head and petting him. And I was like, what do you mean? And she just let him go, and he just went, ka-tunk. And I never screamed Martin so loud. And we intubated him, brought him back. he was fine, but like afterwards, that cat would smack me every single time he saw me and then headbutt me. And he was like, you were the last thing I saw when I saw the light, and you were the first thing I saw when I came back, and they had cookies.
Oh yeah, that cat loved you. It was so funny. He didn't love me as much, but he was fine with me. But he loved Joyce. It was really funny. I'm like, Joyce, Magic's giving me the hairy eyeball. You're gonna have to go get him out of the cage. He looks like he's gonna be mad at me. I don't want to stress him out. She go get him. Sure enough, he would come on in. Yeah, and that's the thing that about veterinary medicine is you definitely have to stay calm and like just do the things that you've been trained to do. That's medicine of all sorts. I guess that's anything really, but as long as you do that and you recognize things quickly, even complications are manageable.
Yeah, like, you know, it took a second and then we brought him back and he was fine, but like him and the owner just made it to where you just like liked what you were doing. Yes, he had a horrible diagnosis. He had lymphoma, but he had already lived with such an amazing quality of life.
Mm-hmm.
You know, like nothing ever got that cat down. You know, he always knew when he came into the building that he was going to get a very big bowl of very like fancy feast stuff because that's what he expected and that's what we catered to him. But yeah, and then
he got the junk.
And then the cases that weren't supposed to make it that ended up making it because it was a group effort. They were in the hospital, but like they weren't supposed to come out of the hospital alive. Those were the ones that made you feel the best also.
Dumpster champagne cases.
Dumpster champagne cases.
We might as well talk about it. That was my thing, is that if a case that we worked really hard and we thought that had a poor prognosis, if we were lucky enough and the animal was good enough to let us save it, then we would have a mini glass of champagne off the clock afterwards. And it was an animal that shouldn't make it, and we would even do it next to the dumpster if we had to, just so we could toast that little guy.
Yep. We toasted to the...
And I've told that to many clients, and they love that their animal was the recipient of the toast.
Yep. And a lot of times that they would come in for the next pet. They would bring in a bottle of champagne to put in the fridge for the next pet that wasn't supposed to make it, but ended up making it. But yeah, we had a couple of those, and those made you feel the best.
Mm-hmm. Yeah, those are the best for sure.
Made the long
those
hours
are the
worth
cases
it.
That on the hard days you remember those, and you remember why you got into this field. When they walk out, when those four little paws walk out the door with their owners and they're smiling, and you know that they're gonna be okay. Like that. For me, like when I'm thinking about leaving the field, it's cases like that keep me.
Yes, and we should all only do it until we don't get that joy from it. God, I'm feeling very joyful this evening, apparently.
Yes,
joy.
I love it.
A lot of joy.
I love it. You should put that on a post-it on your
Sunday.
whiteboard by your ultrasound machine.
Yeah.
And then people, how are you doing today? All you have to do is point to it while you're doing your
Point to my sticky note.
Yep.
This is where we are. Yeah, and you have to have a laugh about it, right? You have to be able to say, you know what, I really wish this patient was doing better.
Yeah, and
so.
Because in internal medicine, I feel too that's something that contributes a lot to, say, compassion fatigue, because you can have more sad days than happy days. It's not puppy visits and vaccines and heartworm tests and things like that. Like a lot of times when these animals, like you said, when they're coming to you, you're a last resort because something is wrong and
like they're really sick. Like they're really sick and they need help.
Really sick. And you find something, like literally put the probe on the abdomen, and it's like, you know what I mean? Like you have to deliver in a lot of instances, more bad news than good, and be there and comfort and console your clients. Not to say you don't do that as a generalist, you know what I mean? But by the time they make it to you, our days in IM can be so much worse than, in a day in as a generalist, you know what I mean? So especially,
and I feel like it comes in waves.
Yeah.
Like I think, like last week I saw 13 things, and I think that most of them on that one day, just everybody had bad diseases. I was like, it's not that I can't offer you something, but I do have a lot. It's just your animals have bad diseases, and at the end of that day, you're like, okay, I helped a lot of people today, but I also had a lot of fatigue that day. So that's the day that you just come home and go for a dog walk.
Yeah.
So, but yeah, I mean, most days the ratio is better than that.
Yeah.
And
Yeah.
you have wins in the ER too. Like when you're, like you said, when you work in a facility where you have your ER, your surgery, and your IM, and something
Yes.
happens in ER, and it's all hands on deck. Even internal
Yes.
med needs to be there. Like,
Yeah.
and that again, as everybody works together as a team, and that animal walks out of there, it goes home. And then there's some days to where, despite the best group effort, you know, and the CPR and the medications and the intubating and, you know, grabbing the ultrasound probe and doing your A fast, your T fast, to where you still, you know, you lose those patients. Like it's like it comes in waves.
Yes. And that actually made me think about one of the things that I am grateful for is that when people I don't take it for granted that people bring me their animals, right?
Yeah.
They can bring them wherever they want. Well, I try to have a lot of grace around when people are stressed, much like the cats that are stressed. I give them a lot of grace, and I give people a lot of grace, because when it's your own animal, I can be stressy, and I might not be as friendly when I'm stressed. And so if somebody is getting frustrated with me because they're so stressed about their animal, I still recognize that they still want me to help.
Yeah, and that's
So.
that's an awesome quality that you have. Because there's some
Well,
people. It is, because when your client gets upregulated, it's really hard for you not to get upregulated. But you offer quite a bit of grace, and I have learned substantially from that as well.
Well, thank you.
Yeah, thank you.
All right. Well, I don't know. I don't know how much we've learned, but we learned that apparently I have a lot of joy.
You have a lot of joy.
And you know what? If that's all we learned, Dr. Martin, that's fantastic. That you have a lot of joy.
Just don't start singing Joy to the World. You'll get me all upregulated.
Oh, yeah. No, I wouldn't do that around you.
No.
I still tell people when the Christmas music comes on, I'm like,
where's Joyce?
I get a little tingly on my back. I'm like, oh, turn that down.
Like you can feel the uproar coming out of Joyce.
And just so you know, it has carried on to the human side. They're not allowed to decorate where I'm at. Like, they can't play music. If they do, it has to be far away. Like, they have learned.
Oh my God.
I get the I get the Grinch mask when we wear masks.
I
have no joy. Pretty much, Martin has all the joy, and I have none.
It's literally in your name, and you have none.
I have none.
Right.
Yeah, Joyce.
I'm just kidding.
Joyce.
You bring me joy.
Oh, Amber, when you were the Grinch, that is still one of my favorite pictures on my phone. I just looked up, and I'm like...
She's like...
This is happening. All right.
Did you know it was me?
I figured pretty quickly that of the people that were in management, that you were probably the person who is most likely to go around and build esteem.
I tried to bring joy to the team.
And bring joy.
And bring joy to the team.
Bring joy.
Yeah, so...
Too funny.
Yeah.
All right, kids. Well, thanks for having me.
Well,
Yes, thank you for jumping on. I know there was some technical difficulties trying to get on, but
Oh my gosh.
we powered through it.
I know. Who knew you had to have that app for everything? Everybody knows that, except for me, apparently.
Well, you know, details, and the whole Canada-US details.
Yeah, I know. But if you do have that problem again,
Now we know.
now you know that app is the workaround.
Yes.
It works.
The Googler tells us.
The Googler told us. All right, guys. Until next time, thank you for joining, and we'll see you guys next week.
Thanks. Have a good night.
Bye. Thank you.
All right. In theory, it's going to stop.